let's discuss secondary tuberculosis today. So, secondary tuberculosis is the infection of an individual who has been infected before, with tubercle bacilli or is sensitized to the pathogen. Now, secondary tuberculosis is of two types. One is the endogenous and the second one is the exogenous. What happens in endogenous is a dormant lesion gets reactivated. A dormant primary complex gets reactivated. And what happens in exogenous is that there is a fresh dose of reinfection by tubercle bacilli. Fresh dose of reinfection by tubercle bacilli. I'll show you with the diagram to make it more clear. Suppose these are a bronchus, this is the bronchi. Then we have the lung here. What happens is, suppose there was a apical consolidation and we have a primary gone complex here. Okay, this is the Gone's complex, and it went there and had a apical consolidation, that is, it got reactivated. Consolidation. Coming on to this part of exogenous, suppose this is it and this is the lung we have. What happens is a fresh reinfection occurs. Primary gone focus was already there and this spreads. Now, where would you most probably see the signs of secondary tuberculosis? You could see them in the lymph nodes of tonsils, pharynx, larynx, skin, and tongue. These are the sites of secondary tuberculosis. Now, what do you see when you see secondary tuberculosis? What is visible grossly? How it happens is, it usually begins with a 1 to 2 centimeter apical area of caseous area of central caseation, or areas of central caseation, necrosis, and peripheral fibrosis. Now, however, there are two fates of secondary tuberculosis. Fate one is that it could heal by scarring, fibrosis, calcification, and the second fate is that it may coalesce together and form larger area of tubercular pneumonia. Then it can lead to fibrocaseous tuberculosis, miliary tuberculosis, tuberculous caseous pneumonia, or it can also lead to tuberculous empyema.